In order to keep your lines clean and clear, they should be flushed daily or as instructed by your healthcare team. Your healthcare provider will tell you what fluid you will flush with. This fluid is commonly saline or heparin, which is a drug that helps prevent blood from clotting inside your lines. The first step is preparation. This involves cleaning your hands or performing hand hygiene, cleaning the workstation you will be working on, laying out your supplies, and then cleaning your hands once more. If you have questions about cleaning your hands or preparing your workstation, refer to the section titled Changing the Dressing. Place all of the items you will need on your workstation. You will need an alcohol wipe and syringe for each line you are flushing. The syringes will be pre-filled with the solution, heparin or saline, ordered by your healthcare provider. If you are flushing 3 lines, you will need 3 pre-filled syringes and at least 3 alcohol wipes. Once your workstation is clean and ready, wash your hands once more. At this point, you may choose to put on a pair of gloves and a mask, but it's not required unless instructed by your healthcare team. If your line has clamps, make sure the clamp on the particular line is open before you begin cleaning the cap.
You want to make sure if you have clamps that the clamp is undone.
When the clamp is open, the triangular part of the clamp will rest outside the top hook.
So I'm going to go ahead and unclamp. Take your finger at the finger hold and you almost take this lip to make sure that it's undone.
Next, take an alcohol wipe and scrub the cap.
So what I like to do is take the center of the alcohol wipe and fold it over the cap, and then I do a back and forth turning motion.
The outside edges and flat surface of the cap should be cleaned. Using this needleless system, you will attach the syringe to the line. Holding the syringe in one hand, using your other hand to hold the cap, push the end of the syringe into the cap and turn clockwise until the syringe is securely in place. Now you will flush the line. If your line has clamps, make sure the line is unclamped. Holding the syringe in your hand, place your thumb on the plunger and slowly push the fluid into the line.
If I were meeting resistance at this time and it were not flushing, I would first want to make sure that your clamp is open. If it's open and you're still meeting resistance, don't continue flushing. You'll want to stop where you are, clamp your line, detach the syringe, and you'll call the doctor.
When you're done, if you have a clamp on your line, close it. Remember, you will hear an audible click when the clamp closes. At this point, hold both the cap and the syringe. Gently twist the syringe in a counterclockwise direction until it comes off. Be sure to throw the used syringe in the trash. Once the syringe is removed, repeat this process for each additional line in your catheter. Each time you flush, you should feel similar sensations and encounter similar resistance. There may be some variation, but it is important to notice any big changes. Some patients report having a sweet or bitter aroma or taste. Some patients feel a cool sensation as the fluids travel through the line. These are normal sensations. Some common questions that patients have include: what if I have difficulty flushing the line? If you or your caregiver are unable to flush the line and the line has a clamp, first make sure that it is unclamped. If you are still unable to flush the line, call your healthcare team. Do not try to forcefully flush the line if you meet resistance. What if I experience chills? If you experience chills when flushing the line, call your healthcare team immediately. This could be a sign of infection. What if I drop my syringe? If you drop your syringe, throw it away and use a new syringe. For any other questions or problems, contact your healthcare provider or healthcare team.